Welcome. Today we're diving into a serious complication that can arise from middle ear infections, mastoiditis. It's a condition that can have significant consequences if left untreated. So let's explore what it is, how it develops, and what can be done about it. Mastoiditis most commonly stems from an unresolved or inadequately treated case of acute otitis media, which is a middle ear infection. Bacteria, often the same culprits that cause ear infections like Streptococcus pneumonia, Haemophilus influenzae, or Moraxella catarrhalis, spread from the middle ear to the mastoid air cells. Less common causes include cholesteatoma, a skin cyst that grows in the middle ear and can erode bone, and rarely trauma to the mastoid bone itself. Now, let's understand how mastoiditis develops. The mastoid bone, located behind the ear, contains air-filled spaces called mastoid air cells. During an ear infection, inflammation and infection can spread from the middle ear into these air cells. This inflammation leads to the breakdown of the bony walls separating the air cells, resulting in coalescence, where the small air cells merge into larger, pus-filled cavities. This process can extend beyond the mastoid bone, potentially affecting surrounding structures like the facial nerve, inner ear, and even the brain. Mastoiditis is most prevalent in children, particularly those under the age of 2, due to their immature immune systems and the anatomy of their eustachian tubes, which makes them more susceptible to ear infections. Before the widespread use of antibiotics, it was a far more common and serious condition. While antibiotic treatment for otitis media has greatly reduced its incidence, mastoiditis still occurs, particularly in cases where ear infections are not treated promptly or effectively. It can affect individuals of any age. The signs and symptoms of mastoiditis can vary, but some of the most common include persistent ear pain, often accompanied by tenderness behind the ear. You might notice redness and swelling behind the ear, causing the ear to stick out from the side of the head. Fever is also a common symptom, as well as persistent or worsening drainage from the ear. In severe cases, headaches, hearing loss, and even signs of meningitis, such as stiff neck and sensitivity to light, can develop. Diagnosing mastoiditis typically involves a thorough physical examination by a doctor. They'll look for the telltale signs of redness, swelling, and tenderness behind the ear. An otoscopic examination of the ear canal may reveal signs of a middle ear infection, such as a bulging or perforated eardrum. However, the definitive diagnosis often requires imaging studies, such as a CT scan of the temporal bone. This allows doctors to visualize the extent of the infection within the mastoid bone and rule out any complications, like abscess formation or involvement of surrounding structures. While classifications aren't strictly defined, mastoiditis can be broadly categorized based on the extent and severity of the infection. Acute mastoiditis refers to a recent infection, while chronic mastoiditis indicates a long-standing, persistent infection, often associated with cholesteatoma. Subperiosteal abscess, Bezold's abscess, and Satelli's abscess are other less common classifications depending on the spread of infection. The primary goal of treatment is to eradicate the infection and prevent complications. Antibiotics are the cornerstone of treatment, typically administered intravenously in the hospital to ensure they reach the infection site effectively. In many cases, surgery is also necessary. A myringotomy, which is a small incision in the eardrum, can help drain pus from the middle ear. If there's a large collection of pus in the mastoid bone itself, a mastoidectomy may be performed. This involves surgically removing the infected air cells from the mastoid bone. If a cholesteatoma is present, it will also be surgically removed. Preventing mastoiditis starts with preventing and effectively treating ear infections. This includes seeking prompt medical attention for ear itches, fever, or drainage from the ear. Completing the full course of antibiotics prescribed by your doctor is crucial. Even if you start feeling better, avoiding exposure to secondhand smoke can also help reduce the risk of ear infections in children. Vaccinations, such as the pneumococcal vaccine, can help protect against some of the bacteria that cause ear infections. With prompt and appropriate treatment, the prognosis for mastoiditis is generally good. However, delayed or inadequate treatment can lead to serious complications, including hearing loss, facial nerve paralysis, brain abscess, and meningitis. Recent research focuses on improving antibiotic regimens, developing less invasive surgical techniques, and identifying individuals at higher risk for developing mastoiditis following otitis media. Early diagnosis and aggressive treatment remain the key to a successful outcome. Thank you for watching.